Hello everyone and welcome to Know Your Drug powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Itraconazole tablets, exploring the various aspects of itraconazole, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Starting with use of Itraconazole tablets. Itraconazole tablets are anti-fungal medications used to treat various fungal infections. The drug belongs to the class of triazole antifungals and is effective against a wide range of fungal species. Itraconazole is commonly prescribed to treat systemic fungal infections such as aspergillosis, blastomycosis, histoplasmosis, and cryptococcosis. Itraconazole can be used to treat fungal infections of the nails known as onychomycosis. It may also be prescribed for superficial fungal infections such as ringworm and tinea versicolor. Then discuss dosage of itraconazole tablets. The dosage of itraconazole tablets can vary depending on the specific fungal infection being treated. It is essential to follow the prescribing doctor's instructions and the information provided on the medication label. For systemic fungal infections, the typical dosage is 200 mg to 400 mg per day, usually divided into 2 doses. Treatment for fungal nail infections may involve a pulse therapy approach, where a higher dose is taken for a week each month for several months. It's crucial to complete the entire course of treatment, even if symptoms improve before the medication is finished. Next, mechanism of action of itraconazole tablets. Itraconazole inhibits the synthesis of ergosterol, an essential component of the fungal cell membrane. By interfering with the synthesis of ergosterol, it disrupts the integrity of the fungal cell membrane, leading to increased permeability and ultimately cell death. This mechanism of action makes itraconazole effective against a broad spectrum of fungi. Now discuss side effects of itraconazole tablets. While itraconazole is generally well tolerated, like any medication, it may cause side effects. Some common side effects includes gastrointestinal disturbances like nausea, vomiting, diarrhea, or abdominal pain. It also has central nervous system effects like headache and dizziness. Some skin reactions like rash or itching may occur. Serious side effects are rare but may include liver problems, heart failure, or allergic reactions. It is crucial to seek medical attention if any severe side effects occur. Then, important advice for taking itraconazole tablets. Take itraconazole tablets exactly as prescribed by the healthcare provider. Do not alter the dosage without consulting a doctor. Itraconazole is usually taken with a full meal to enhance absorption. Inform your doctor about all medications you are taking, especially those that may interact with itraconazole, such as certain antacids, rifampin, or certain statins. Some patients may require regular monitoring of liver function tests, especially during long-term treatment. If you experience any unusual symptoms or side effects, contact your healthcare provider promptly. Remember that this information serves as a general guide, and individual cases may vary. Always consult a healthcare professional for personalized advice regarding your specific condition and treatment. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking itraconazole tablets. Remember, knowledge is power, and being well-informed empowers you to make the best decisions for your health.